Palliative care means to me the treatment of a terminal disease in a manner which allows the patient to continue living with dignity, comfort and respect. The treatment no longer suggests a matter of days to live, but begins at the diagnosis stage, to prepare the patient and to allow him or her to come to terms with the illness, and also to prepare his family and friends for the inevitable outcome, but in a calm, reasoned and normal manner. I believe it lessens the terror and the fear that I normally associate with such an illness. I also believe that it helps the patient to come to terms with the inevitability of the outcome in a more holistic approach by supporting not just physically, but also mentally, emotionally, and of course spiritually.
How would you describe palliative care to someone who had never heard the term before?
I would explain that palliative care is care for a patient who is due to an incurable or terminal illness is not going to recover. The care is of no fixed duration. It can be long-term or short-term, depending on the severity of the illness. I would explain further that a patient is firstly a person, just like you or me, with many interpersonal relationships. For instance, spouse, parents, children, relatives, and friends. Human beings do not live in a vacuum. When the patient is diagnosed, these very important relationships continue. The patient is still the same person. It is only his health that has changed. While the diagnosis is extremely traumatic for the patient, it can also be traumatic for those near and dear to the patient. Treating such a person in isolation is, in my view, futile. It is a waste of very valuable resources. If the near and dear ones are excluded, I believe that a valuable opportunity is missed to improve the patient's life and those of the carers. It would also leave a void in the carers' lives afterwards. The regrets of "if only" are of no value and unnecessary. Palliative care is, I think, a concerted effort between the experts and the lay carers. They worked jointly to improve the end of life of the patient, to prevent unnecessary stress, fear or loneliness. A holistic approach will result in enormous benefits for both the patient and the relatives. Gone are the days when there were two camps, the patient in one camp and the relatives in another. They are all now in the centre, each one helping the other. When the patient has the full support of the team, of the entire team that is, his specific needs can be addressed. And these specific needs would be those of making a will perhaps, putting his financial affairs in order, advice on how best to deal with minor children, and perhaps there are children with special needs, and there may also be a divorce situation or separation which needs to be addressed and dealt with also. The sooner palliative care is addressed, the better it will be for all concerned.